Dr. Mark Changizi here, your science moment. Today I'm going to talk about free expression and censorship on social media, on Twitter, and the general media's general attitude towards that kind of censorship. And it's motivated by an article in the Washington Post. And I talk about that, this particular article, because it appears that maybe the media, and Washington Post in particular, is sticking up for free expression. But unfortunately, it's only an illusion, and it's actually much worse than that. It really illustrates, in fact, exactly what's wrong. So here's the Washington Post story. Here's the headline: Twitter labeled factual information about COVID-19 as misinformation. So this is an August 25th, 2022 story. So, boy, they sure are late to the ball game. I mean, they've been censoring us on Team Reality, who are arguing for evidence-based approaches and cost-benefit analyses to COVID, and calming folks down, and also pushing civil liberties, that you can't just do whatever you wish, and pushing the precautionary principle, all the things that we've been talking about here. We've been censored. Hundreds of high-profile, incredibly bright people have been permanently suspended off of Twitter and YouTube and Facebook for doing these, pushing these their viewpoints and making these arguments, categorized as misinformation, or in some cases disinformation, which is of course absurd. We're genuinely making our arguments. We're always showing the evidence, and of course, even if it turns out we're misinformed, as we've talked about repeatedly. This is how conversation and debate and discussion happens. It happens not with just the true side. It happens by virtue of all sides, and it's through that process that we slowly make our way towards the truth. This is true in science itself, and this is true in society, in the conversation of the public square more generally. So here's the title: Twitter labeled factual information about COVID-19 as misinformation. Wow, like Twitter's been doing the wrong thing. It's been labeling factual things as misinformation concerning COVID-19. Well, yeah, they've been doing that for 2 years. So why are you suddenly mentioning this now? This is great that you're mentioning this, Washington Post. And then you read the subhead here, which says doctors, scientists, and advocates of what, you have to wonder here. Doctors, scientists, and advocates attempting to warn the public about the dangers of the virus have had tweets flagged and accounts suspended. Okay, now you getting an image here. Here's the problem, and as we'll see as we go through a little bit of this, the problem isn't that Twitter and social media generally, top-down, controlled, coordinated by the federal government, unabashedly. The problem is not that they're censoring the truth. The problem is that they're censoring those who have been trying to warn the public about the dangers of the virus. Right? They're saying the problem is that the misinformation label has been applied to the mainstream narrative, and that's the problem. So let's just go through this a little bit, just sort of a little bit more slowly here in this article by Taylor Lorenz of the Washington Post. So over the past week, Twitter has flagged dozens of tweets. Oh my God, this is a problem at the scale of dozens. And of course it is a problem. I'm going to make jokes about it. But of course, I don't want, and folks that understand free expression don't want anybody on Team COVID, on Team Panic, censored. One, all of us rely on everybody's speech. And two, there's many multidimensional facets to this, but of course I also want them to be held to their speech, and I want them to lose reputation on the basis of it over time. I want their speech there. Their speech reveals who the crazies are, right? Over the past week, Twitter has flagged dozens of tweets with factual information about COVID-19 as misinformation, and in some cases has suspended the accounts of doctors, scientists, and patient advocates in response to their posts warning people about the illness's dangers. Now, so it would be bad just to be flagging and suspending people for misinformation, whether or not the posts are warning people about the illness's dangers. What if they were warning people about the dangers of the interventions that are supposedly supposed to protect us from the dangers of the virus, right? What if you're talking about those costs? What if you actually want to do a cost-benefit analysis? Only those people who are just talking about the benefits are the folks that when they're censored, it's a travesty? Right. Many of the tweets have since had the misinformation labels removed and the suspended accounts have been restored. Okay, so we've got a dozen people who were censored wrongly, and that shouldn't have happened, and it should never happen. And they've been reinstated, for the most part, within a week. Meanwhile, tens of thousands, hundreds of thousands of voices on the other side are gone. Not all of these are high-profile folks that you would have ever heard of. Hundreds and hundreds of high-profile folks with big impact have been completely decimated, taken out of Twitter altogether. Gone. I've been permanently suspended many different times, reappealed, got in, and have had more than a year of drastic deboosting so that I'm labeled like I'm a porn star in there. And I have all the same kind of labeling such that the porn stars do. But the episode has shaken many scientific and medical professionals who say Twitter is a key way they try to publicize the continuing risk of COVID to a population that has grown weary of more than 2 years of shifting claims about the illness. Well, you can imagine, we know exactly what it's like to be shaken as scientific and medical professionals when Twitter, and we're trying to publicize our viewpoint about the cost-benefit analyses and what's at stake, the larger economic consequences, the civil liberties consequences. Can you imagine? We're shaken too. Right? Except that Washington Post never had an article about censorship until a dozen or so of their tweets were censored. Right? In interviews with the Post, Twitter acknowledged the problem. The company removed the labels and restored the accounts after queries about 10 specific tweets and accounts. So there's been 10 specific cases of censorship of the mainstream narrative. And that's what this article is about, in the midst of a massive campaign, government directed, for 2 years against any opposing viewpoints to the mainstream narrative, right? So this is just boggles that they write this with a straight face. And again, they're not lying. They really don't see it. They think, of course, social networks should only have true stuff, and the true positions are on our side, and so anybody in the opposition should, of course, be censored because it's wrong, right? I mean, look, if you don't think about free expression, you don't think about networks, you don't think about these things deeply, that sounds kind of right. Like, why should people be allowed to publish false stuff? You know, it's a very naive but intuitive point of view, right? And you don't really expect much from your average journalist or politician than naive points of view. Here's Twitter spokesman Celeste Carswell. We're always working to improve the safety of our service and ensuring we provide avenues of recourse when we get it wrong through our appeals process. We acknowledge the mistakes made in these cases, and we are reviewing our team's protocol to safeguard against such mistakes in the future. We appreciate the community's feedback and remain focused on reducing harm and providing informative context across Twitter. All right. I mean, the subtext there is, we really messed up, we censored the wrong side. Some users received messages from Twitter apologizing for the mistake. Well, I never got an apology for their mistake. And I published cited actual publications that got one of them. My first or second suspensions was just citing a published document on NIH servers. Our support team has reviewed your account and it appears we made an error. One email reviewed by the Post said, we've determined that the tweet is not in violation of our COVID-19 misleading information policy, that therefore your account should be restored in full functionality. We sincerely apologize for any inconvenience and hope to see you back on Twitter soon. Joanna Poe, an oral pathologist with a PhD in molecular biology who had one of her tweets flagged last week for misinformation, the flag was later removed, said discussion of the misapplied flags has been a big topic in the science and medical communities on Twitter. It happened to quite a number of medical people and people in bioresearch, she said. So let me just, in discussion of the misapplied flags, right? The premise that they walk in with is that flags are good. Misinformation flags are good. That's what you need. It was just, okay, we're not, even if we don't censor everybody, and kick them off, and we'll just flag all the stuff that's not true, because got the oracle that tells us the truth and the not truth, and so we're just going to flag all the non-truths, right? Surely that's going to be helpful to society in moving towards the truth. Just label the non-truths. We'll just flag them. Oh, but you misapplied your flag in this case. That was the problem. It was the misapplication of the oracle. It was unknown how many tweets or accounts have been affected by the mislabeling, but Poe said that even if Twitter's actions affected relatively few account holders, the wrongly applied flags undermine the authority of the science and medicine community and weaken efforts to counter vaccine or COVID misinformation. Even a dozen misapplied flags amongst a million flags against those that are counter-narrative really undermines the effort. All right? So, I mean, the idea that this could be published with a straight face by anybody but somebody in an elementary school boggles my mind. In terms of public perception, it puts into question our credibility as scientists, she said. If we put something on Twitter like a research study and you say it's wrong, it invalidates everything we're saying. Because, now think about what this means. It means that their statement as a scientist, they view it as having very little credibility. Now, when I write, I'm writing not because I'm hoping for Twitter to validate it, or fact checkers or undergrad, far left fact checkers to validate it. I'm putting it up there with my own reputation backing it. It's me that backs it. I don't want Twitter to back it or to non-back it. Stay the F out, right? That's the point. We get the reputation that we have by virtue of our history of claims that we've made and the extent to which we were right or wrong. We don't want some centralized committee, much less a fact checker, undergrad fact checker, marking and making claims, putting their nose in it. Emily Vraga, an associate professor at the University of Minnesota who specializes in misinformation, well, I mean, I don't think that means what it could be taken to mean, said Twitter's recent errors confuse people and feed conspiracy theories. Yeah, now they don't know what to think. Now it could be that they have to actually weigh both sides and go read the evidence themselves and come up to an actual opinion based on thought, rather than being told what's true by virtue of the fact checkers, right? And that could be bad, because then the network might move on its own, slowly trying to find what the truth is, rather than being told in advance by the centralized community what the truth is. We know that when accurate information is labeled as false, people are less likely to think it's accurate, even when it's shown to be true, she said. Well, indeed. I mean, this is one reason I'm pissed off. We're all pissed off that if we're allowed on Twitter at all, our tweets are labeled as misinformed, as dangerous, and so forth. It undermines, even if they're, of course, it undermines us because they're actually preventing other people from seeing it. But when they do see it, they're given this label, and a lot of folks are on the fence, like, well, I don't really know, maybe Twitter's right? So of course, we're exactly used to it. But a dozen of you accidentally experienced this, and the moral of that is that it's just not a good idea generally. No, the moral of that apparently is that make sure that it's only on our opponents that the misinformation label is applied to. Well, then she added that long-term misapplication of the label could also lead users to distrust Twitter's misinformation systems entirely, rendering the label useless. Okay, so the premise here is that she's a misinformation expert. If she's a misinformation expert, it means she must have an expertise on the truth, like concerning vaccines and lockdowns and everything, right? Because how can you be an expert on misinformation if you don't understand where the truth is and what mechanisms exist to make these decisions in every kind of case? There's no experts in misinformation, right? I'm a pretty good expert in misinformation in certain areas of my field, but nobody is an expert in misinformation generally. Throughout the pandemic, Twitter has struggled to contain misinformation on its platform. And again, it means we know totally what the misinformation is, and we can see it. It's coming in as all these red tweets over, like the redder they are, the more misinformed they are. We can just track them where they are, and we're trying to push them back, like this unclean mass of misinformation. And we've struggled to contain it. In April 2020, Oxford University researchers released a study showing that nearly 60% of the false claims about COVID remained online without a warning label. Oh my God, like we see all of this false stuff, counter-narrative stuff, and not every single one of them has been yet labeled because they need more and better technology to label every last one of the counter-narrative claims. That's their moral. Anti-vaccine sentiment has also thrived on Twitter. Now, anti-vaccine sentiment can, in fact, be, I believe vaccines work, but people shouldn't be forced to do it. That would be an anti-vaccine sentiment. It certainly was taken to be an anti-vaccine sentiment, right? You're anti-vax unless you were on board with mandatory vaccines, you were considered anti-vax, right? So, are you false? Are you engaged in misinformation if you believe in bodily autonomy and that people should be allowed to make their own choice? Was that a misinformed viewpoint? Was that false? Is it the kind of thing that can be false in the normal sense of, in terms of a factual, evidence-based claim? When precisely the current problem began is uncertain, but it has been a subject of conversation among medical professionals and scientists on the platform since at least last Thursday. Oh my God, misinformation, censorship of misinformation has been a real problem since last Thursday. Now remember, it's August 20-something right now, right? Of 2022. And since last Thursday, censorship of misinformation has become a problem for medical professionals and scientists on Twitter. With tweets calling attention to the issue garnering thousands of likes and retweets, as they have for Team Reality for 2 years, when sometimes they would censor a tweet and say this is an unsafe tweet and you're not even allowed to retweet it. We would invariably quote tweet it and then have people retweet the quote tweet. We've been doing this for 2 years, dealing with this issue. And it's been a subject of conversation amongst medical professionals and scientists that just happen to not be on the mainstream panicked narrative side. On August 16th, Henry Miller, a physician and molecular biologist who worked for 15 years as a medical reviewer at the Federal Food and Drug Administration and as a research associate at the National Institutes of Health, wrote about his experience after he posted a headline about new vaccine research. The tweet, which he said he posted on July 28, was labeled misinformation. Miller deleted his tweet to re-access his account, as they make us do, as they used to make us do. They didn't make me do that recently. But he said the platform should apologize to him and other pro-vaccine, pro-science communicators. It's nice to be on the anti-science side. Myself, it's glad to see he's on the pro-science side. He wants to have an apology for those who have had their tweets flagged. It shows you how disorganized the monitoring of disinformation on Twitter is, he said. They're just in disarray. All right. They have an idea. These are supposedly sophisticated professors, right? They're not sophisticated. They're sophisticated in their microfield, but they're not sophisticated. They believe that they're sophisticated, but they believe that there can be an organized information monitoring system that determines which things are true, which statements are true, and which statements are not, and thus which ones should be censored and which ones should be not. There doesn't exist such things. If there was such a thing, it would be really nice. I could say, look, I don't know if this is true. I'm just going to start tweeting hypotheses that I'm unsure about on Twitter, and their organized system for monitoring disinformation will tell me, oh, this is true and that's not. I go, this is great. I can write a paper on it because it wasn't flagged as disinformation. Right? Nobody can do that. And Henry Miller is maybe the most genius one of all, right? But they're all geniuses because they can all do this. They're all misinformation experts. Another user, Anita Chang, a former molecular biologist who was embedded in San Francisco's emergency COVID response team, said one of her tweets promoting vaccination was mistakenly flagged 2 weeks ago. Not mistakenly in the sense that it shouldn't be flagging anybody, mistakenly in the sense that I'm on the good side, guys, and you flagged me as misinformation. And Chantal Moore, a science and tech writer in Vancouver, said several of her tweets sharing information on how to keep safe by wearing N95 masks had been flagged as far back as June. Other Twitter users were temporarily suspended or had their tweets flagged after sharing CDC data on childhood COVID deaths. Right? Each one of these cases that they go through and mention are cases on the pro-COVID narrative side, which was that we should do any intervention, that the interventions work, that COVID was disproportionately dangerous. And there's just a dozen of these people, which shouldn't have been censored at all. Nobody should be being censored. And this article is crying about these dozen, right? And pretending as if free expression matters. Fareed Jalali, a gastroenterologist in Southern California, had a tweet flagged that was reacting to an article in the scientific journal Nature about the continued risk of cardiovascular problems even many months after COVID infection resolves. Again, if you're posting about harms to young children of COVID, if you're posting long COVID related things, if you're posting anything that's very pro-vaccination, all of these things, if you were to accidentally get flagged, it is a travesty. Why is it a travesty? Not because of free expression, but because your team member, Twitter, and the federal government, who's coordinating with them, accidentally censored the wrong side. Helga Gutmane, co-founder of the Long COVID Research Initiative, of course you know how this is going to go, a nonprofit group that promotes research into long COVID, said wrongly applying misinformation labels to tweets makes it harder to get scientific information about long COVID to the public. On Saturday, Twitter flagged as misinformation a tweet the initiative posted linking to a paper in Nature on COVID transmission from mothers to babies. Twitter later removed the label, but the mislabeling confused her followers, she said. Her followers got confused. Can you imagine that they got confused because some true thing that you said, even citing something, was labeled as censored or removed, right? That could cause confusion, couldn't it? The fact that Twitter's been involved in this kind of confusion at a crimes of humanity level, at that scale, for the last 2 years, during an emergency, the emergency being not really the pandemic, but the fact that the world started to beat as one and implement peacetime authoritarian measures never seen before, makes Twitter, Facebook, and YouTube culpable, among many others. It's an all-around assault on just getting factual information out, Jalali said. Whereas in 2020, the public seemed united in efforts to conquer the virus, doctors said that now people across the political spectrum often direct vitriol toward anyone attempting to raise awareness about the often devastating effects of COVID-19. So then they go through a few more about how now those that are still pushing the alarm and irrationality about COVID are getting bombarded by folks saying, stop, just settle the F down, right? Meanwhile, in the first 6 months and in the first 2 years, you know who was being attacked as deniers and unclean and grandma killers and anti-vaxxers and actually, you know, long petitions written about them to kick them out of universities and on? Those on Team Reality. They were hated upon and treated as outgroups for the kinds of reasons that I've talked about before. We have now a dozen folks at Twitter who were accidentally labeled misinformation after 2 years of ridiculously dangerous levels of misinformation pushed by the medical community, academics, public policy folks, and politicians. Twitter themselves, by censoring the opposition, us, Team Reality, was the biggest misinformer at all. Because when you censor one side of the conversation, especially the truth side, you are the biggest misinformer at all. And just as a reminder, these are the kinds of, like in Business Insider, showed graphs like this, comparing the infection fatality rate of flu, which is very low, because it's an infection fatality rate. It's the probability of dying if you get it, period. And they compared that to the case fatality rate of COVID. The case fatality rate is an entirely different thing. It's among those who are sick enough to show up at the hospital or to a clinic. Amongst those, what's the probability of dying? And those numbers tend to be 2 orders of magnitude higher than they are for infection fatality rate. And over again, graphs like this comparing apples and oranges were shown, leading in early March to the kinds of mass fear and mass hysteria and the positive feedback loops that led to all this. Right? Media, social media, that pushed those kinds of false comparisons led to what we're still enduring and will be probably enduring for a decade in these kinds of events. I wouldn't want those folks censored for doing so, but when you censor the opposition, we can't even reliably argue against that irrationality. All that you get is that hysteria growing and spreading even more quickly. And that was your science moment. Go ahead and give Dr. Tim Barber, my new book. Go give it a look at Amazon or at Barnes & Noble. We need your support. It's about the origins of emotional expressions, 10 years in the making. We have been censored ourselves. We are the subjects of targeted censorship. We have FOIA requests out to the government, and with our lawsuit with NCLA, and we're hoping to get information back on that, but we have been both targeted from the federal government, targeted from Twitter. All of the journalists which are all far left won't cover us and our book and our discovery, which is not only a discovery about the origins of emotional expressions, it's also about what it is that masks cover over and destroy, and it's about the origins of and the foundations of how free expression itself works. How does it work in large groups? To understand that, you have to understand the way that emotional expressions function and why they function and why they do what they do. Also, give us some support at our Free Expression Institute. We founded an institute designed to study free expression, to understand it from a 21st century perspective, so that we can understand these kinds of psycho-societal events. And that was your science moment.